Hi, my name is Judy Mullally, and I'm one of the social workers here at Memorial Healthcare Systems at the hospital. And today I'm joined with my friend Jane Reamer to talk about National Healthcare Decision Day, which is a day that Memorial Healthcare Systems has observed for several years now. Thank you, Jane.
You bet. So Judy, what is National Healthcare Decision Day?
So National Healthcare Decision Day is celebrated every year on April 16th annually. And the whole purpose of it is to inspire and educate and empower people, the public as well as healthcare providers such as here, about the importance of advanced care planning. And advanced care planning can include something that's called advanced directives, which is what we're going to talk about today.
What is an advanced directive?
Very good. That's a good question. So an advanced directive is typically a twofold legal document. The first part of it that it addresses is who to assign as your healthcare decision maker or healthcare power of attorney. That can include more than one person. It could be a primary and a secondary. A healthcare power of attorney or decision maker is someone who, when you can't or I can't make decisions for myself, temporarily or permanently because of a health issue or whatever, can then step into my shoes and make those healthcare decisions for me. A second part that can be included in an advanced directive is what's called a living will. And a living will gives direction not only to your power of attorney, healthcare power of attorney, but also your healthcare provider, your doctor, so that you can say to them, you know, if I'm to the point where I'm at end of life, have a terminal illness, or in a persistent vegetative state, it's okay not to do these things. It gives that direction. So, yeah, that was a good question. And I should mention, only 37% of Nebraskans actually have an advanced directive.
Wow. That's not very many.
No, it's not. Yeah.
So how old do you have to be to complete an advanced directive?
Sure. In Nebraska, by statute, you're considered a legal adult at 19. So anyone who's 19 years of age or older can complete an advanced directive. I think the important thing to remember is that this is a document you need to have before you need it, not the time to be talking about it when you need it, because oftentimes it can't necessarily be completed at that time. So it helps you plan ahead for others on what you would or would not want for care. It allows for that important conversation with the people, your loved ones, your family, to be able to say to them, I want to talk with you about these things if this were to ever come up in my lifespan.
And that's probably why sometimes when we come to the hospital, they ask us if we have one of those, an advanced directive, before we receive care.
Correct. That is exactly right. Okay. You are spot on.
And are there certain people that I should make aware of this or give a document to?
Yeah,
a copy to?
Actually, your doctor should have a copy of it. The people that you appoint should have a copy of it. Sometimes people will give it to their pastor or their priest or their spiritual advisor, whatever that might be. Sometimes people will keep the healthcare power of attorney, the advanced directive, in a safety deposit box. That's actually not a good place to keep it, because other people, if you had something happen and they needed to be able to have access to that document, it'd be very difficult to get that. So at the very least, give everyone copies that you think would make sense, particularly your doctor, the hospital, the clinic, and the people you've appointed.
So that's great information for me, but how do I start this conversation with people that I love or people in my life?
You know, Jane, that's sometimes the hardest thing, is to talk about things that are hard, but those are sometimes the most important things we can do. So the good thing is that online there is a website, and it's called the Conversation Project, actually. Yeah. So it has a downloadable starter kit that will allow you to print out, that has several pages, and it'll ask questions for you that then you can share those answers, or even questions to have with your loved ones, your spouse, your children, whomever it is you're looking at having that conversation with. Yeah. So it also has, a lot of times at the Conversation Project, each state's advanced directives that you could also download in order to complete those out. So not only does it help you get the conversation started, but it gives you the tool on how to complete it and to complete it as well. Another important option is actually to go see your own attorney. Part of a lot of attorneys' work in their estate planning with their clients is doing advanced directives, is doing financial powers of attorney, those kind of things. So that can be a very good place to go too. The other thing that can be a good conversation starter is what's called the 5 wishes. And I'm going to read to you what those 5 wishes are, because that helps you and I, or you and your husband, or myself and my husband, to have the conversations we need to have. The 5 wishes are: who do I wish to make healthcare decisions for me when I can't? What kind of medical treatment do I want or don't want? How comfortable do I want to be when I'm at end of life? How do I want people to treat me? And what do I want my loved ones to know? I think those are pretty important 5 wishes. Don't you think?
Mm-hmm.
Yeah, and important wishes that can be obtained and easily met with those that we love and those who love us.
That's great.
Yeah.
Well, this has been awesome to learn about advanced directives and healthcare decision day. Is there anything else you'd like to share? Any final thoughts?
No, you can certainly call us, the social services office here at the hospital, and we can send you a copy of some advanced care documents as well. I just think it's important to remember that advanced directives are not something to think about someday. It is a present day opportunity to do it, to address the what ifs that can occur in your entire lifespan. So let's all be a part of the conversation, which the conversation is about you. Okay?
All right.